Hello again, welcome to day 8C. This is chapter 19, the circulatory system, or you can call it the cardiovascular system, has everything to do with the heart and the functions of the heart and how, the heart pumps blood and distribute blood, circulate blood throughout the body. So the heart, some definitions here. There are four chambers of the heart. You have two upper chambers and two lower chambers, responsible for distributing blood in and out of the body, in and out of the heart throughout the body. The atria, the upper two chambers of the heart, is called the atria, and then the lower two chambers of the heart is called the ventricles. Systole. You've heard of systolic and diastolic. Systole is the phase where the heart is working, contracting, and pushing blood out of the left ventricle. So when you're listening to a person's blood pressure, you're listening to the heart contracting, pushing blood out. That's the systolic. Then when it's relaxing, that's the diastolic. We'll talk more about that next. The diastole or diastolic, that's the phase when the heart muscle relaxes. So it contracts and pump blood out, that's your systolic. Then relaxes, that's your diastolic. Arteries carry blood away from the heart, and capillaries, tiny blood vessels where exchange of gas and nutrients occur. Veins, vessels that carry blood to the heart. Remember, the arteries carries blood away from the heart. The veins carries blood to the heart. So that's your picture of the heart and the whole network of circulatory system. All right. So the structure and function of the heart and the circulatory system, we said that made up of the heart. The circulatory system is made up of the heart, the blood vessels, and blood, and the different types of blood. You have the white blood cells, which protects the body from bacteria and viruses. The plasma, that's the liquid portion of the blood that carries nutrients and waste products and hormones and salt and antibodies and all these other substances necessary for blood clots. So when you have a cut, it's the plasma will work quickly to form a clot to prevent blood loss. Again, function of the heart: pumps blood throughout the body, transports oxygen, function of the blood now. Transport oxygen, nutrients, hormones, antibodies, removes carbon dioxide from the cells, control pH level and body temperature, clots, and fight pathogens as well. So normal changes in the elderly, and this is the area we always focus on. Why do we study all these body systems? Well, to understand how each body system affects the elderly. Circulatory system here, how does it have, what are the normal changes in the elderly that we have to look for so we can report them when they are not normal? Okay, so as we get older, the heart pumps less efficiently, blood vessels narrows and become less efficient, blood vessels become less elastic, blood flow decreases. Okay, so everything kind of works slowly. Occlusion means that there's a complete obstruction of the blood vessel. Ischemia is lack of blood supply to a particular area. Hypertension, points to know about hypertension. So what causes hypertension? Hardening and narrowing of the blood vessels. Kidney disease, tumors, pregnancy, stress, pain, and some medication. We talked about pre-hypertension in vital signs, and as if your vital signs, if your numbers are getting close to 140/90, it means you're pre-hypertension. Let's say you're like 136, 138/88/89. That means you're getting close to becoming hypertensive. Symptoms of hypertension: headache, blurred vision, dizziness. It can lead to heart attack, stroke, kidney disease, blindness. Treatments for it: there are medications, diuretics, exercise program, dieting, quitting smoking, and lowering your stress level. There are several terms here that will describe different disease of the heart, different conditions. All of them have one thing in common: the narrowing of the artery or the narrowing of the vein. The blood vessel, where the blood flows, narrowed, either because of a clot that blocks it or because of fats and cholesterol. As time goes on, that passageway become narrow and narrow because of fatty tissues growing in that vessel and then narrowing it. So you're going to have different names: coronary artery disease, myocardial ischemia, angina pectoris. All of this, again, narrowing. Over time, you have narrowing of the artery or vein that will cause any of the heart problem. Angina is chest pain. When you have somebody that is about to have a heart attack, it will start with like a chest pain, sharp chest pain. Okay. So a stable angina, chest pain that occurs when a person is active and under severe stress. Unstable angina, chest pain that occurs while the person is resting. So it means when it's stable because the person is exercising or doing something, then they start having chest pain. It's called unstable angina when they're just relaxing and it happens. There's a tiny pill called nitroglycerin. It's a medication that we give when somebody's about to have a heart attack. It's tiny, goes under the tongue. It's given sublingually. They are to just leave it under the tongue and let it melt. They don't swallow it. It helps relieve the chest pain and kind of reduces the chances of the heart attack from happening. So we did talk about, all of this coronary artery disease have something in common. The artery narrows, buildup of arterial plaque, fats, which now reduces blood flow, normal blood flow to the body. So how do we handle angina and other heart-related conditions? Reduce the stress level to the heart and notify the nurse immediately if you see a resident having issues. Make sure resident gets enough rest. Avoid big meals. Encourage resident to follow the exercise plan, do your range of motion, take them for a walk. They should avoid hot or humid weather. Encourage them to stop smoking, but that's tough to do. My resident used to tell me, he said, "Boy, if you don't stop disturbing me, I've been smoking before you were born, and I ain't dead yet. I'm still alive." Well, they'll say it ain't gonna kill me. It would have killed me by now. What are you going to do? All you can do is try and just keep trying. Cardiomyopathy is weakening of the heart muscle due to enlargement or thickening that reduces the heart's ability to pump blood effectively. Okay. So we talked about those already. Points about myocardial infarction. This is the block when blood flow is blocked to the heart muscle, causes heart attack. Okay. Cardiac rehabilitation, and this is when maybe somebody is recovering from a heart attack, then they have to go through cardiac rehabilitation, you know. So points to know about that: they need to be on a special diet, low cholesterol, low fat, low sodium. All these three things don't get along with the heart: cholesterol, fat, and salt. Okay, they have to be on a regular exercise program. They have to have medication that, you know, keep the heart rate and blood pressure at normal range. You know, blood testing. They have to stop smoking, avoid cold temperature. They have to manage their stress. You know, they have to be on a stress management program. Okay. Peripheral vascular disease. That's the condition whereby the legs, or the arm, the feet, or hands doesn't have enough blood circulation. Sometimes it will lead to swelling, you know, of the feet. So blood flows down to the feet, doesn't flow back up effectively. Okay. Phlebitis, inflammation of the vein in the lower extremity. That's like swelling. Anti-embolic stockings. You have to know about this very well, because it's one of the skills tested in the, I think it's skill number 3. How to put on anti-embolic stocking, also called elastic stockings. But you have to know why. What does it do? Why does the resident need anti-embolic stockings? Well, it helps to reduce blood clots and help with circulation. Also helps to prevent swelling. So you could get a question on your GNA exam that says, which of the following would help a resident reduce swelling in the lower extremities? You know, lower extremity meaning the feet. So your answer, if you see elastic stockings in there, that will be your best answer. Okay. So we talked about peripheral vascular disease, PVD, and we said elastic stockings helps to reduce that. Again, it's a buildup of arterial plaque over time, which then affects, you know, normal circulation. All right, let's move on. We've covered this already. How to put on the elastic stockings. You will watch the video of that in the skills video, and then try to put the steps in order in your skills quizzes. Okay, but you can see pictures of it here. Step 1, step 2, step 3. It has to be wrinkle free. You cannot put it on and then it has lots of wrinkles in the middle, and then you try to pinch it to straighten it out. When you do that, you're going to be pinching the resident's skin. If you do that during the GNA exam, that's enough to fail you. And if you fail one skill, you fail all of it. So you have to follow the proper way to put the stockings on properly. Okay. Sequential compression device. It's like a plastic air-filled sleeve that is placed around the leg, and it, you know, blows up, inflates and deflates regularly to help improve circulation. That's something that is handled by the nurses. Congestive heart failure. Again, this is, you know, you've heard of heart failure before. Once the heart stops pumping, then, you know, it's going to lead to heart failure. Kind of like when the engine stops running and then it stops, then, you know, engine goes. Autopnea means shortness of breath when lying down, but when the person sits up, they breathe better. So heart failure, congestive heart failure, what causes it again? Failure of the heart muscle to pump effectively due to a damage one of the damages that we've talked about before, either a blockage or other kinds of damage. Symptoms: fatigue, reduction in ability to be active, difficulty breathing, dizziness, swelling, things like that. There's right-sided failure and then there's left-sided failure. All right, we're not going to go into details of that. That's kind of for nurses. So guidelines for heart failure: residents follow doctor's orders in terms of activities and exercises. They will, sometimes might be on a daily weight check and intake and output to see what they're able to take in and what comes out. Encourage them to follow diet order. We talked about that earlier. They might be on a low cholesterol, low sodium diet, low fat. Use special stockings. We talked about the anti-embolic stockings and so on. Use extra pillows to kind of put under their head so that they can breathe better. Assist them with ADL as much as possible. Assist with range of motion. Pulmonary edema is like when you have fluids in the lungs. Okay. And anemia, it's a condition in which the amount of red blood cells is less than what the body requires. This is when they have to take like iron pills or have like a blood transfusion. Hypoxia is a condition in which the body does not receive enough oxygen. Okay, what causes anemia? Again, red blood cells is less than normal required for the body and so on. So that's the end of your